take concern about healthcare IT? What's the motivation? Now, this is a new statistics. The reason I have to use a new statistic is because everyone knows what has been happening past 2-3 months, COVID-19, coronavirus. And because of that, all the statistics forecasting of last year is down the drain. We have new statistics coming in, new forecasts coming in. Healthcare IT is on steroids. It's growing like nobody's business. So this is just one statistics. It's a new statistics. I got the URL down there, okay, which states that telehealth is nothing but your ability as a patient to be able to speak to your provider, your doctor, remotely. Just this market alone to grow 30%, almost 30% to a $5 trillion market within the next 5 years, okay, 4 to 5 years, okay. And as I mentioned before, healthcare IT has not adopted many of the technology. And now, suddenly, we see it being adopted. Okay? Not so much on suddenly, this has been happening slowly. Just right now, it has accelerated massively. A quick example is AI, right? Medical decisions are being made by computers now. Now, I'm not saying that it will be replacing doctors. It's never the case. The whole idea is that, I'm sure you've heard of IBM Watson before. So it is said that IBM Watson engine is able to read through, process 4,000 pages of medical journals in 1 second. So the doctors community has agreed that they will be able to use tools like IBM Watson to assist them to make medical decisions, right? Cancer decisions, detection has skyrocketed. Means now using AI, doctors are able to detect cancer much more at an earlier stage, all right, for using various variables using AI, all right, self-assessment. And I don't have to start talking about Alexa and Siri and Google Home. This will not replace your doctors, of course, but medical services are being embedded within these engines day by day, right? Moving on, blockchain. Everyone knows blockchain. I think the fintech is the reason why blockchain has picked up, since the late 2010 till now. But nevertheless, blockchain is being embraced by medical data simply because we need it. We can't trust a traditional database to store your medical record on the cloud. So blockchain, no doubt, is so far a trusted method. And it enables your EMR from a hospital and your EHR nationwide to be stored. And this will in turn be integrated with your insurance companies, ensuring the data integrity. As I mentioned, virtual teleconsultation, telemedicine. Thanks to COVID-19, right? We also have RPM. RPM is a remote patient monitoring. Quick information. One of the highest costs in a hospital, especially private hospital, is actually the bed, right? That's why if you notice, most hospitals are categorized by the number of bed you have. A small hospital is somewhere between 50 to 100, 120 bed. Typical example would be your Columbia Asia in Malaysia. That's your small hospital. Medium size would be your between 150 to 200, 300 bed, and a large size would be anywhere between that to 5,000 bed, right? The goal is to clear the bed as soon as the patient is treated. But it's always the case that after a surgery or after a procedure, patients still have to occupy the bed for monitoring, sometimes few days, sometimes even few weeks, okay? So technology like RPM, remote patient monitoring, uses devices, sensors like IoT devices and sensors, which we can place the patients back home or at a nursing care center at home. The provider will be able to provide almost similar kind of services by monitoring all the vital signs and everything. And once we clear the bed, what can we do? We can place another patient and do another procedure and surgery for the patient. So virtual consultation doesn't stop where you see the doctor in a video conference like this, but it goes beyond that, where the patients are monitored using IoT devices, right? Moving on, cloud computing. So I don't have to teach too much about this. Everyone knows the private cloud, and we have the public cloud.
Before 9, right?
Okay, I see some voices. A quick public announcement. Can you help me to mute your mic? Unless you have something urgent to mention, then you can unmute your mic. Other than that, kindly mute your mic, everyone. Thank you. Okay, going back to the cloud. So we have the public cloud and private cloud. Now, private cloud is fairly straightforward. No doubt it is, you will have to be compliant with many standards we have, many regulations and compliance for private cloud. But things get complicated when you go on a public cloud. Companies like Amazon, Google, and Azure is hungry for your data. Back in the US, Australia, in fact UK, they have already adopted the legal framework has allowed the NHS data, the government public data to be stored as long as it gets certified, okay, in a certain way. But the Asian country, as far as the Asian country is concerned, our regulation framework is still not on par, still not updated with what the market, what the healthcare industry actually needs. So we have an imbalance. So it's also an opportunity, not so much a technical point of view, because technically, I think I missed out Alibaba Cloud. Alibaba Cloud is also coming very strong in Malaysia now, in fact, throughout Southeast Asia. So all this data eventually will sit on the public cloud, if you ask me. And there's opportunity for that. There's job opportunity for that. There's certification opportunity for that, and so on. Okay, basically we need people who can do these kind of jobs. Okay, and all this boils down to patient's data, right? So let it be your patient's mobile app, let it be your sensors of the world, the garments of the world. We even have sensors which you wear on your waist, and the sensor will constantly monitor your blood sugar. It doesn't inject any needles into your body, thank God, but it constantly monitors your blood sugar by using your sweat, right? And this feeds data to your mobile apps on your phone, and that feeds data to the hospital cloud industry, so the hospital data center, and that feeds data to the cloud, all right? Let it be national cloud or your public cloud. And yeah, so we have the IoT of the medical things. And last but not least, with all this data going on, we have terabytes. In fact, it's going on to petabytes of data being generated right now. I give a quick example. So sometimes when I talk about this, people are unable to fathom how big of a data which we're talking about. I assume everyone's familiar with X-ray. You know, typical X-ray you take of a fractured leg or something. And then there's something called CT scan is there, something called MRI is there, okay? Let's take a typical example of a CT scan, right? If you take a CT scan machine of a 64 slicer, hold on, CT scan of a 64 slicer means you have 64 pictures, scans of a particular part of your body, right? That one image with 64 slice produces 100 megabyte, right? An average high traffic hospital will be scanning about 1,000 patients a day. How much of data is that's about over 10 gig just one day for one hospital. Can you imagine how much a group of hospitals, or rather nationwide, or the world is producing in one day, just CT scan alone, out of one machine alone? Can you imagine? And I've not started talking about MRI machine or X-ray machine. And one hospital, a good one, will have 2 CT scan machine easily, a large one, or maybe 2 or 3 MRI machine, loads of X-ray machines, your database, your flat files, your patient's data. So firstly, this data will have to be stored somewhere. There comes your cloud computing. Then this has to be secured. There comes your IT security. Then this data has to be stored in a secured way. So there comes a blockchain. Then you need to analyze this. There comes your big data, there comes your AI. And guess what? None of this actually has gone mainstream yet. All right. So if you're asking why you should pay attention to healthcare IT, there you have it. In fact, I can just end my presentation here and you will be done with it, you know. This is a simple reason why, you know. Anyway, before I finish the whole presentation, this one slide, let me move on. Okay,